So in my role as Associate Dean for Diversity and Inclusion, I get to focus on improving diversity and increasing the climate that we have for inclusion and equity here at UNR Med. And we have a lot of different initiatives to do that. We have a number of student initiatives that is run through our Admissions and Student Affairs branch, and they do all kinds of things to increase student diversity, which I love as one of the faculty members here who gets to work with those students. Also, to support our commitment to diversity and inclusion, we have a very significant diversity curriculum that occurs here at our medical school. In the first year alone, students have over 20 hours of content related to diversity in medicine, including an assessment of implicit bias that they take at various points throughout their training. 3 points. They take it during orientation, they take it midway through, and they take it towards the end of their training. They also receive training on implicit bias and healthcare disparities, and then we look at specific things like issues related to various different patient populations. We have a safe zone training, we have an LGBT panel, and we do a lot of things along those lines to really try to get our students to understand that that they need to have culturally competent skills to take care of patients from different populations, and that we really need to do work to address the healthcare disparities that exist for patients from these different backgrounds. We're also working to increase the way that that curriculum looks in clerkships as well as in our residency programs. And we're also working on creating pipelines for our residency programs as well. Another thing that I love about UNR Med is that we have a variety of different diversity student groups. We have the Student National Medical Association, we have the Latino Medical Student Association, we have the Asian Pacific Islander American Medical Student Association, we have a Women's Medical Student Association, and we also have a student interest group for our LGBTQIA, and that particular group has so many allies and they're wonderful. I get to serve as the faculty advisor for a couple of those groups, and also those groups have all come together to form a student diversity council. They meet on a monthly basis and they take turns hosting, they do social activities, they do educational activities. Our LGBTQIA student interest group has put on case conferences once a month where they invite speakers or they just talk through cases that involve issues related to patients who might be from the LGBTQIA community, and we just talk through those. And so we definitely have a very active student interest in diversity, and the students have come together and are working with some of the faculty in really furthering their knowledge and their cultural competence to work with patients from different backgrounds. So that's been exciting to be a part of. And so diversity is something that I think we can easily say is valued not only in word but also in action at all levels here at UNR Med.